Causes of diabetes mellitus. Unlike diabetes symptoms, the causes of diabetes mellitus are numerous and may change from person to person. They will also be different, depending on whether you have type 1 or type 2 diabetes. The final type, gestational diabetes, is triggered by a woman becoming pregnant and generally only lasts as long as the gestation period, but can leave her more susceptible to type 2 diabetes in the future. Causes of type 1 diabetes. At a very general level, interactions between genetic inheritance and infections or viruses cause type 1 diabetes. The general theory of the causes of diabetes mellitus type 1 is that a person is born with a genetic disposition towards the disease, but it is unlikely that a baby will have diabetes from birth. A virus or an infection generally triggers type 1 diabetes, which typically strikes during infancy or adolescence. This disposition to diabetes means that any disease that attacks the immune system will affect the pancreas, causing it to shut down. Sadly, no test exists for predisposition to type 1 diabetes at present, so the first that most sufferers know about it is when they are diagnosed with the illness. Causes of type 2 diabetes. The number of people suffering with type 2 diabetes drastically outnumbers the number of people with type 1. This is because the causes of diabetes mellitus type 2 are all due to lifestyle choices. Unlike type 1, type 2 diabetes generally strikes people in adulthood, although childhood obesity rates are on the rise as an increasing trend of young people are contracting the illness. The following is a sample list of causes of diabetes mellitus. Diet. The links between diabetes and diet are obvious, as a poor diet tends to include foods high in carbohydrates and fats that break down into high blood sugar levels. These high blood sugar levels put a lot of stress on the pancreas to produce more insulin to break it down, and like any body part, the pancreas suffers from overuse. Obesity. Obesity is often linked to a poor diet as the body struggles to process the number of calories and the refined carbohydrate. Obesity comes as a result of excess fat being stored around the body, and while different people store their fat in different external areas, obesity causes fat to cover all of the major internal organs. This covering of fat impairs their function, which in terms of the pancreas prevents it from producing appropriate levels of insulin. Alcohol and tobacco. Any drug that changes your mood or perception effectively acts as a poison on your system. The terrible feelings associated with the come down from nicotine and alcohol stems from your body having to process the toxins to get rid of the drugs. Like with any poisons, alcohol and tobacco affect the performance of internal organs, especially those charged with purifying and processing, such as your pancreas. Stress. The pace of life in the Western world now means that everyone seems to juggle many different things daily, which can lead to emotional stress. Stress has a very strong causality with a range of illnesses and diseases, because it reduces the effectiveness of your immune system. It can also affect your eating habits, as many people resort to comfort eating to deal with the stress. As you can see, the causes of diabetes mellitus type 2 are all controllable by making positive lifestyle choices. Sometimes you can contract type 2 diabetes with no symptoms whatsoever, and the disease will only become a problem when your immune system is compromised. Your medical professional will test you for diabetes without any symptoms, if you feel that your current or previous lifestyle choices may have been conducive to contracting the illness. Learn more at www.livinghealthywithdiabetes.com.